This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you.
This is going to be Chapter 28, Infectious Diseases, Rash. And key concepts. Upon completion of this chapter, you'll understand that rashes may indicate a benign or a life-threatening condition. So finding a rash is an important clinical sign. The importance of including a patient's vaccination history as a part of the past medical history, and the importance of surveillance and early detection of infectious diseases as public health measures that involve paramedics. So chief concern, the mnemonic test, useful in learning diseases is transmission, epidemiology, symptoms, and then treatment. And we're going to identify these various diseases by their symptoms. Awareness of transmission vectors, so that the spread of the disease can be prevented. And then these are the diseases and modes of transmission. So chickenpox, common cold, influenza, whooping cough, TB, mumps, measles, and rubella are all droplet. Fecal oral, cholera, hepatitis A, polio, and salmonella. Sexual, HIV, chlamydia, gonorrhea, and syphilis. This is table 28.1 in your book. Childhood diseases, immune system responses and overcomes. Great resistance is developed through interaction with these diseases. It kind of toughens up your immune system. Typical infectious diseases of childhood are things like chickenpox, which is the varicella zoster virus. The vaccine developed for this made chickenpox a rarity after its development. Only effective for 10 years, though. Incubation period is about 10 to 20 days. Positively linked to congenital birth defects if mom has it. Most contagious 2 days before the first pox. A small, itchy, irregular-shaped blister appears. Treatment is largely supportive. Antihistamines to relieve the itching. Acetaminophen for low-grade fevers. Avoid aspirin, and that's because of Rye syndrome. The disease Rye syndrome is caused from an interaction between a virus and aspirin products. Causes essentially a fatty liver or cirrhotic liver. Severe encephalopathy or swelling of the brain. The liver may be slightly enlarged and firm. There's a chance in the appearance of the kidneys. Jaundice is not usually present in this condition. Roseola, caused by the herpes virus, transmitted by airborne droplets or physical contact. Let's just kind of check these off here. Talk about roseola. Highly contagious. It starts as an unexplained fever. The fever subsides in approximately 1 to 2 days, and a rash on your trunk appears. Treatment is hydration and fever reducers, things like Tylenol. Rubiola, measles, ancient disease caused by the paramyxoxovirus, rubiola, transmitted by inhaled airborne droplets or contact with infectious fluids, most contagious during 3 to 5 days after rash appears. After 2 weeks incubation period, the patient will start to experience prodromal symptoms, cough, head cold, runny nose, conjunctivitis, and eye irritation. Koplik spots, irregular shaped red spots with white centers, resembling a bullseye inside the oropharynx along with the buccal and lingual mucosa. Treatment on this is going to be antipyretics, quarantine, and rest. They are very contagious of rubiola or the measles. Rubella, mumps. Painful, swollen salivary glands are pretty much a distinctive clinical marker for the mumps. Spread by inhalation of airborne particles of spittle or contact with saliva-coated clothing. Highly contagious. Typical symptoms are fever, headache, sore throat, distinctive swollen parotid glands. Treatment, antipyretics, and ice to relieve discomfort. And avoid aspirin in this one also. And then last but not least, rubella or the German measles, characterized by a distinctive red rash, transmitted via airborne droplets and can be passed in the urine and feces. Mild, short-lived infection, averaging about 3 days. Some patients, particularly women, may develop joint pain or arthralgia. Unborn children whose mother contact rubella, particularly in the first trimester, is at risk for congenital rubella syndrome. Classic triad of this, or as far as findings of this after it occurs, congenital rubella syndrome, is deafness, eye abnormalities. Widespread use of triple vaccine has dropped incidence dramatically, and this vaccine that we're talking about is the MMR, measles, mumps, and rubella. Pediculosis, lice, not a microbial infection, found on the head and body or genitals. Spares no economical group. Anybody can get this. Endemic in some regions. Infest either clothing or hair, and the treatment is permethrin or Nix or methionine ovide. Focus on preventing the spread of the lice. Scabies, mites barely visible on skin. They burrow under the skin, causing pruritus. Pregnant mites tunnel under dead skin and they lay their eggs. Transmitted through direct contact. Treatment on this is going to be, again, permethrin or quell. Permethrin or lindane, which is quell, and then focus on preventing the actual spread. STDs are sexually transmissible diseases. Produce prodromal syndromes, rash, headache, viral symptoms, sexually transmitted infections. Patient remains asymptomatic. These infections include syphilis, gonorrhea, chlamydia, and HIV. Syphilis, causative agent is a spirochete. Causes lesions during sexual activity or by contact with the blood. Can be passed horizontally from mother to child. 3 stages, primary, secondary, and tertiary. Treatment for this is going to be antibiotics. Next one on our list is going to be gonorrhea. Causative agent is Neisseria gonorrhea, transmitted by contact with infection to penis, vagina, and anus. Can also be transmitted horizontally to newborn during passage through the birth canal. Treatment for this is also going to be antibiotics. Chlamydia, caused by gram-negative bacterium, Chlamydia trichomatis, leading cause of PID or pelvic inflammatory disease and infertility. Infected woman is a particular risk for infertility, ectopic pregnancy, and miscarriage. Premature rupture of membranes and preterm labor. Newborn of women with chlamydia tend to have a low birth weight and risk neonatal pneumonia and conjunctivitis. Treatment is going to be supportive care and antibiotics. HIV, which is a retrovirus transmitted in blood, semen, vaginal fluids, and breast milk. It's not generally transmitted in the saliva, urine, feces, and tears. Transmission modes, sexual intercourse, shared needles, horizontal from mother to child during childbirth. Stages, initial infection. There's a clinical latency page, and then acquired immune deficiency syndrome or full-blown AIDS phase. Declining immune system response leaves patient vulnerable and opportunistic to opportunistic infections and cancers. Symptoms are fever, swollen glands, weakness, weight loss, and AIDS dementia complex. So treatment is generally supported for this. Emerging infectious diseases. The last 100 years of medicine decreased disease and morbidity and mortality. Causes of this, decreased morbidity and mortality, or improved sanitation, vaccines, antibiotics, and improvements in medical detection and treatment. The increased U.S. deaths are due to infectious diseases, and causes on that: increased urbanization, modern transport, lack of universal health care, microbial adaptation, and the creation of drug-resistant strains of infection. Classification of new diseases like SARS, emerging diseases, West Nile virus, and drug-resistant infections. Infection control is the first step in surveillance and early detection. And whenever we look at infection control, they kind of look at clusters, and clusters are events such as multiple cases of diarrhea that would pop up. Morbidity and mortality weekly report They share the epidemiology information of disease prevalence. Contamination strategies are also used in infection control, isolation, quarantine, and restrictions. EMS and infection control precautions are things like hand washing, wearing gloves, masks and gowns, cleaning contaminated surfaces, and minimizing contact. Public vaccination programs. A vaccine is created by one of the three common mechanisms: an inactive pathogen, the use of a weakened or attenuated virus, or purifying a subunit of a virus. Vaccinations are the administration of pathogenic proteins to produce an antibody response in a process of artificial immunity. And there's three types of vaccinations. There are ring vaccinations, person immediately at risk due to their proximity with the infected or ill. Target vaccinations, with the disease contained, remaining populations of the affected area are vaccinated. And then mass vaccinations, disease origin cannot be found, and the vaccination of the potential population at risk is in order. History. Procedure, ascertain the chief complaint, and then look at their symptoms or inquire about their symptoms. Headache, loss of visual or auditory acuity. This would suggest something central nervous system involvement. Stiff neck. This would be of meningeal involvement. Breathlessness, wheezing, or productive cough. Gastrointestinal symptoms. Nausea, vomiting, diarrhea, as well as loss of appetite. Drug history, if they have a history of IV drug use. Fever, when it started, how high has the fever actually gotten? If the patients have taken anything for fever control, like Tylenol or antipyretics. And then pruritus, itching sensation that originates in nerve endings of the skin. Past medical history, when we look at it, consideration should be immunization history and proof, the patient's last meal, signs of any anorexia, gastrointestinal symptoms, nausea and vomiting, and then any type of preceding events. Recent foreign travel would be an example of this. Contact tracing, investigating who might have been exposed, prevents secondary cases of infection, requires patient to reveal their acquaintances. It does breach privacy, outweighed by the public good. Reportable diseases, whenever we're looking at this, diseases of public health importance, and the Department of Health or the CDC may quarantine the patient. Examination, procedure, in a head-to-toe fashion. Airway, we should be looked for reddened areas suggestive of pharyngitis as well as exudates. Eyes, examined for rhinorrhea, fluid in the nose, and conjunctivitis. Throat, palpate the temporomandibular joint for point tenderness. The anterior neck, signs that the parotid glands are inflamed. The posterior neck, signs of swollen lymph nodes, lymphadenopathy. And that would be proximal to the length of the carotid groove, right underneath the chin on the sides. Exanthema, whole body rash, the body's immune response to a pathogen. Procedures on this, note appearance if it's raised or flat. And whenever we notice a rash, was it papular, which is a raised lesion, vesicular, which has tiny blisters, or macule, which is flat, can be felt. The color range can range from brown, which are more likely freckles, to red, purpura, purple or maroon colored lesions. Comes to mind septicemia at this point, which is a systemic blood infection, especially if we think the patient has purpura, and petechiae, which are pinpoint lesions with the same discoloration. So like little hemorrhages that look like someone took a pin and pinpointed them on the body. Distribution. Rash may not only be seen on the extremities, or may be a central rash that starts at the core and migrates to the extremities. Assessment. Meningitis is divided into two types of assessment. Either we're looking for viral or bacterial. Viral is most common. Causes are the enterovirus and chickenpox, mumps, herpes simplex type 2, and influenza. Bacterial meningitis is possibly lethal. Causes are pneumococcal and meningococcal, and Haemophilus. Treatment. General care. Protection of personnel, anybody that's involved, in the public. Supportive care, rest, reducing the fever, and relieving discomfort. Those are generally by supportive measures. Evaluation, classic triad of meningeal signs would be nuchal rigidity or stiff neck, photophobia, or the light hurts their eyes, and headache. Triad indicates a risk for possible generalized seizure or status epilepticus. Neisseria meningitis, gram-negative bacterium, potential meningitis-induced seizure etiology. We do have a decreased U.S. incidence of this. However, the bacteria and the effects develop rapidly. Untreated may lead to seizures, coma, and death within 24 hours. And most of the time, the doctors treat it empirically, which means they start the treatment prior to diagnosis, just off of signs and symptoms. Rabies, transmitted by saliva, or the bite of an infected mammal. Causative agent is the Neisseria virus. Causes encephalitis, which is acute infection of the brain, inflammation. And hydrophobia. Patient cannot drink for fear of choking. Preventative measures on this are immunoglobulin post-exposure, and that almost eliminated the cause of rabies, or that almost eliminated rabies as the cause of death in developed countries. Symptoms: large quantities of saliva, they're drooling, and difficulty swallowing. Tetanus, rare in the U.S. due to immunizations. Causative agent is found worldwide, which is an exotoxin of Clostridium. Symptom complex, can appear like convulsion. Symptoms are spasm of the skeletal muscles, trismus, rhisis sardonicus. Trismus is tightening of the jaw muscles, clenching of the teeth. Rhisis sardonicus, contortion of the face, raised eyebrows, twisted grimace, like an evil sneer. Opisthotonus, massive skeletal muscle contraction that caused the entire body to arc. Poliomyelitis, previous and major cause of paralysis, may now be eradicated worldwide. Mass vaccination programs is how this occurred. Rise to public consciousness, this may be from the iron lung invention. Transferred via fecal-oral route, phases or incubation. Classic prodrome of viral infection. Classic meningeal signs, and difficulty breathing as a result of muscle paralysis. Treatment for this is a trivalent oral polio vaccine. Treatment on this patient is going to be largely supportive. Included analgesia for muscle pain, antipyretics for fever, and respiratory support as needed. As far as the disposition goes, individual cases is something along the lines of a barrier device or isolation rooms. And this would be if you only had one or two patients. And then on epidemics, require modification and planning. Ambulance modification, positive to negative pressure environment. Notify the receiving facility prior to your arrival. In conclusion, infectious diseases are commonly encountered. Adequate infection control procedures. Importance cannot be overemphasized on this. Protects from the spread of infectious diseases, or protects us all from the spread of infectious diseases. And references for this can be found from Myers Paramedic Volume 2, Medical Emergencies of Delmar Learning. If you have any questions concerning this chapter, feel free to give me a call. My name is Roy Smith, roy.smith@redlandscc.edu, or 405-219-7613. Thank you.